The center has had national recognition for decades and has shaped the conversation around alcohol use.
The Center of Alcohol Studies started at Yale University. It came to Rutgers in 1962. It's the oldest program in the nation.
What came out of the center was a whole new philosophy about alcohol and alcoholism. It was a multidisciplinary center, so they brought in not only physiologists and biologists, but they also had sociologists working there and psychologists.
I think there's a certain proportion of people who have started to understand that addiction could be viewed more as a chronic illness, like diabetes, and less like something that is a moral weakness.
Eventually got the AMA to accept the fact that alcoholism was a disease.
There's the idea of doing, 12-step work in other communities that kind of help promote recovery, but to literally bring it out of the shadows really does a lot for someone else, because it helps eliminate the stigma, and stigma for me is not strong enough of a word, because honestly, people are literally dying.
So here in addiction education, we are really intentional in how we address stigma and working with minoritized populations.
They got one of the first Alcohol Research Center grants, and that funded getting our longitudinal study started.
A core feature was doing research that was going to inform treatment.
We started one of the first studies to follow New Jersey adolescents from early adolescence into young adulthood and looked at the development of alcohol and drug use over time. They developed treatment programs, the first outpatient treatment programs for alcoholism. We published more than 150 papers looking at causes and things that led up to drug use and the consequences of adolescent drug use for later adult functioning.
We have a journal that is the oldest journal in the United States, the Journal of Studies on Alcohol and Drugs.
They began the Summer School of Alcohol Studies in 1943, and that continues today as the Summer School of Addiction Studies.
It's kind of our signature program. It happens every year.
It just has to be experienced. And I know we're in an age of Zoom, and it's easy to get information just from anywhere, but there's something about being here with all of the dynamics, the personalities, just the energy, the knowledge that flows that makes this special.
So we do spend a lot of time working with our peer specialists, and they're a very important part of the center and who we provide education for, but we also bring them in to help guide us and advise us on our research.
We definitely focus mainly on addiction professionals, mental health counselors. We also have sometimes medical students and people in the law enforcement, as well as military.
We also provide addiction education to our communities, the research, postdoctoral level, and students at the university, and people who are interested in getting certified in alcohol and drug studies.
Our newest program is the Alcohol and Drug Abuse Counseling Certificate, and this program allows people to get the 270 education hours that's needed for the CADC. It's a certificate in alcohol and drug counselor.
We operate under evidence-based practices, so we feel that it's really important in order to guide us to do the best treatment that is the most efficacious. We want to have it be science-based.
And so I think that research is extremely important in this work so that we can better help those who are struggling.
And people from the center also helped form this National Institute on Alcohol Abuse and Alcoholism.
We provide conferences, seminar series. I think our responsibility is just to help to further addiction education and help practitioners in kind of gauging the science to the practice piece.
We're always in the business of trying to bring in the latest evidence-based experts in a whole diversity and range of fields so that we can keep everyone on the cutting edge of what's going on and what do we know in our work, so that people can feel confident that the treatments that we're recommending are those that actually work. Our addiction education summer school program and many of our professional development seminar series are an opportunity for professionals in the field at every different level to interface with one another and to have a more interdisciplinary experience in their education.
Around 2003, we got a center grant from NIDA to look at prevention of drug problems instead of just studying it, but actually applying what we've learned to prevention.
We've done pioneering work related to alcoholism that happened here. It's pretty incredible.